Welcome to MED-MYSTIFY. Today, we're taking a dense, kind of overwhelming pharmacological cheat sheet and transforming it into a highly retainable mental armory of anti-neoplastic agents. If you've ever felt totally bogged down by the sheer volume of cancer drugs, how they work, and their incredibly specific toxicities, well, you're absolutely in the right place. We're going to build a framework today that actually makes all this information stick.
Here's exactly what we're covering today. First, unmasking the enemy. Then we'll dive into our specific weapon classes, the alkylating agents, the antimetabolites, antibiotics, and plant products, and some miscellaneous heavy hitters. Finally, we'll wrap it all up with a high-yield, rapid review.
All right, let's jump right into Section 1, Unmasking the Enemy, focusing on cancer characteristics. Before we review our weapons, we really have to understand the precise nature of the threat, right? You just can't deploy an arsenal without knowing your enemy. Anti-neoplastic or anti-cancer drugs are medicines specifically designed to destroy or inhibit the growth of cancer cells. The crucial takeaway here is that these agents are essentially systemic saboteurs. They're built to interrupt the very processes that allow cells to multiply, mostly by targeting cell division and DNA synthesis.
And why exactly do we need such aggressive saboteurs? Well, because this enemy is relentless. There are 4 defining characteristics we have to consider. Cancer cells exhibit totally uncontrolled division. They have completely lost their normal regulatory bricks. Instead of staying put, they invade surrounding local tissues, and ultimately, they metastasize, spreading to distant organs all across the body. Basically, to stop a biological machine that refuses to turn off, you literally have to break its gears.
Let's move to our first major classification to build our attack strategy. Section 2, the alkylating agents, are DNA crosslinkers.
I want you to think of these agents as throwing a massive physical wrench right into the cellular machinery. They work by transferring an alkyl group directly to DNA bases, specifically the N7 of guanine. This creates a physical crosslink in the DNA strands. Because the DNA is essentially glued together, it just can't replicate. That inhibits DNA and RNA synthesis, which inevitably induces cell death. And a really important point, these are cell cycle non-specific, meaning they can hit the cell at absolutely any phase, whether it's resting or actively dividing. Now, it's important to understand the distinct friendly fire or side effects each of these heavy hitters carries. Mechlorethamine is historically a big deal as the first clinically useful nitrogen mustard, but it's highly reactive and causes severe bone marrow suppression. Then we've got cyclophosphamide, which is super common for breast cancer and lymphomas. It's a prodrug, but you absolutely must remember its classic toxicity, hemorrhagic cystitis. That's severe bladder bleeding. Finally, busulfane. It's an alkyl sulfonate used for chronic myeloid leukemia, but it carries the notorious risk of causing pulmonary fibrosis, famously known as busulfan lung. So, we've seen the blunt force crosslinkers. But what happens when a cancer drug actually mimics the very building blocks of life itself to sabotage the cell from the inside out?
That brings us to Section 3, the antimetabolites, which are S-phase specific. This is a really fascinating form of biological espionage. Unlike our previous class, these do their damage specifically during the S phase of the cell cycle, right when the cell is actively trying to synthesize new DNA. Consider how methotrexate, one of our most famous antimetabolites, executes this. It's a folic acid analog. First, it targets and inhibits an enzyme called dihydrofolate reductase, or DHFR. By doing this, it prevents the formation of tetrahydrofolate. Without that, the cell can't produce thymidine. And no thymidine means DNA synthesis grinds to an absolute halt. It literally starves the cell of its essential building blocks.
But methotrexate isn't the only structural imposter. We also have mercaptopurine, a purine analog. The absolutely crucial takeaway here is that it's metabolized by xanthine oxidase. That means its toxicity is dangerously amplified if a patient is also taking allopurinol, which is a common gout medication. You got to watch out for that. Then there's fluorouracil, or 5-FU, a pyrimidine analog that stops DNA synthesis by inhibiting thymidylate synthase, and cytarabine, which halts the whole process by directly inhibiting DNA polymerase. They all basically trick the cell into using faulty parts.
Okay, let's transition from those synthetic imposters to toxins derived directly from nature. Section 4, Antibiotics and Plant Products are natural poisons.
Now, when you hear antibiotics in this context, please don't think of a Z-Pak for a sinus infection. These anti-tumor antibiotics derived from the Streptomyces species, are heavy-duty DNA saboteurs. They wedge themselves right into the DNA, a process called intercalation. From there, they produce highly damaging free radicals that literally break the DNA strands apart. And they inhibit topoisomerase II, which prevents the DNA from unwinding for replication. They just rip right through the cancer cell's defenses.
But of course, with immense power comes severe collateral damage. If you only memorize one thing from this section, burn these 2 toxicities into your brain. Doxorubicin is famous for causing dose-dependent cardiomyopathy. It essentially destroys the heart muscle over time. Bleomycin, on the other hand, causes severe pulmonary fibrosis, scarring of the lungs. But interestingly, it does this with minimal suppression of the bone marrow, which is super unique among cancer drugs.
Moving over to plant products, let's talk about the classic Vin twins, vincristine and vinblastine, both derived from the periwinkle plant. They share the exact same mechanism. They bind to tubulin and arrest the cell cycle right in the middle of mitosis, the M phase. But consider their highly tested toxicities. They are completely opposite. Vincristine spares the bone marrow, but causes severe peripheral neuropathy, so nerve damage. Vinblastine, conversely, causes massive bone marrow suppression.
Now, let's mop up with a couple of standalone agents that don't quite fit the previous molds in Section 5, Miscellaneous Heavy Hitters.
First up is cisplatin. This is a brutal heavy metal weapon, literally a platinum coordination complex. It works kind of like the alkylating agents by forming crosslinks in the DNA, but the high-yield takeaway is its toxicity profile. It causes severe nephrotoxicity, destroying the kidneys, and ototoxicity, causing hearing loss. Because of this, aggressive hydration and diuresis are an absolute requirement to protect the patient's kidneys when administering this drug. Then we have mitotane. If cisplatin is a shotgun, mitotane is our biological sniper. Its mechanism of action involves the highly selective destruction of the adrenal cortex. Because of this incredibly specific targeting, it's used specifically for adrenal cortical carcinoma.
All right, we've covered a massive amount of pharmacological ground today. Let's move to Section 6, High-Yield Rapid Review, and lock all of this in.
In clinical practice, and honestly on every major pharmacology exam you'll ever take, you absolutely must know how to save the patient from the weapons you're deploying. These are your rescue shields. If you give methotrexate, you rescue the healthy cells with leucovorin, which is also known as folinic acid. To protect the heart from the devastating cardiotoxicity of doxorubicin, you administer dexamethasone. And to stop that severe hemorrhagic cystitis, the bladder bleeding from cyclophosphamide, you absolutely must give mesnite.
Let's lock in this ultimate one-line revision. Take a mental screenshot of these facts right now. Alkylating agents cross-link DNA and are cell cycle non-specific. Antimetabolites block S-phase DNA synthesis. Antitumor antibiotics intercalate DNA and generate free radicals. Vinca alkaloids block microtubules in the M phase. And etoposide, which we briefly touched on as a plant product, acts by inhibiting topoisomerase II.
The war between cancer and pharmacology is just ever evolving. We've mastered the art of cellular sabotage using these classical agents, but cancer continues to mutate and adapt. As cancer mutates, so must our armory. What brilliant, ultra-targeted weapons will science engineer next to outsmart this relentless enemy?
I really hope this explainer has helped demystify these powerful agents for you. Like, subscribe, and share for such more informative explainers. Also, add comment topics on which you like to see the next explainer. We will catch you in next one.